There are several modifying factors that increase your risk for developing asthma or having asthma exacerbations related to air pollution. One is socioeconomic status. If you live in a poor neighborhood, there are data to show that you have an increased risk of asthma exacerbations. This is likely multifactorial. Part of it may be poor access to healthcare, so you're not getting controller medications to keep your asthma under control. But it also may be that you have increased stress because violent crime in your neighborhood is occurring and you're scared of that. Or you're having a relatively poor diet because there are no supermarkets with good quality produce in your neighborhood. In any event, there are neighborhood factors and socioeconomic status factors that increase the risk for asthma. There are also racial and ethnic differences in both exposure to air pollutant and in healthcare utilization. For example, African-American kids have a greater risk for showing up in emergency rooms with severe asthma. And other racial ethnic groups and Mexican-born Latino kids actually have a lower risk compared to white children. Here are three maps of Los Angeles on this slide. The one on the upper left is showing the proportion of people of color living in these areas. The one on the lower left is proportion of people in poverty. And the one on the far lower right is showing exposures to two traffic-related air pollutants, diesel exhaust and nitrogen dioxide. Basically, you should see that these maps more or less align. The dark areas are where there's either greater residents of color and or greater poverty, and these areas also have greater exposure. So this study from colleagues of mine at the School of Public Health at UC Berkeley shows that if you're a poor person of color in Los Angeles, you're likely to have greater exposure to diesel exhaust and to nitrogen dioxide from traffic emissions.